Okay, welcome everyone to the Breast Cancer Education Workshop and Panel. So over the next hour and a half, we will first introduce you to our panelists, panel of experts. Then we'll share a presentation. From there, we will go into a discussion with our panelists, and we will wrap things up with question and answer if we have time towards the end with our panelists and you, the audience. And then lastly, we will do a raffle for a $25 gift card. Just know that you have to be present to win that gift card. So our intention tonight is to provide this discussion panel. In providing this discussion panel is to provide information, share opinions, calm hearts and minds, offer hope and encouragement, and answer your questions. So please share your questions for the Q&A session in the Q&A chat box. If you would like to say hi to any of the panelists or to make a statement or just to introduce yourself, you can use the general chat box for that. If we're not able to answer your questions during this session, I will be putting our email address into the chat box, and you can follow us on Instagram and Facebook at SD Care Center, because we'll be doing our best to answer questions through our virtual fair that we're having throughout the month through videos and informational posts. So before we get started, I do want to say a disclaimer that this information provided in this discussion is for informational purposes only. What will be shared during this time are the personal and professional opinions and views held by the panelists. If you or someone you know is experiencing any medical needs and need help now, please seek help from a licensed professional, a service provider, or your local authorities. The number for some free services or low-cost services will be added into the chat box. So with that, we can get started with panelist introduction. And Jill.
Hi, everyone. I'm Dr. Jill Borman. I'm a psychiatric mental health nurse, and my interest has always been in spirituality and well-being. And so I have spent the last 20 years of my career doing research at the VA, studying a mind-body spiritual intervention. We call it Mantram repetition. I also have a clinical appointment with the University of San Diego, and I love to teach, and I'm happy to be here. I want to thank Danielle for coordinating and inviting me to the panel.
Thank you, Jill. And then next we will have Elaine.
Hi, I echo the same sentiments. Thank you, Danielle, for inviting and for organizing this. I'm really honored to be here on this panel. I am a general surgeon. I specialize in breast surgery, though, and I founded a nonprofit called Compassion Breast. Its mission is to provide both uninsured, underinsured, and under-resourced communities with timely, quality breast care. And so I'm really, again, happy to be here, and I'm looking forward to the panel.
Thank you, Elaine. And then we have Christina Starr.
Hello, everyone. Thank you so much for this opportunity, Danielle, and for the whole care community. My name is Christina Starr. I've been practicing natural health for over 20 years. I've had a passion since I was a little child. Primarily, I work with and focus on individual needs per person. So wherever they're at, I like to meet them if they have a lot of anxiety, if they have fear, or if they have a concern. We usually start with the mind-body connection, as others have shared. And I do specialize in homeopathic remedies, as well as nutrition and environment, and keeping close watch as any and all people need help or assistance, especially with being an advocate, to be a second person to help with any kind of information or confusion. And I have a ministry I started about 5 years ago, and I go down to the West Indies and Nevis, and I work in a clinic there, donating and interning with the natives, and also assisting with other types of natural care.
Thank you, Christina. And then we'll go on to Shannon.
Good evening. My name is Shannon Seduti, and I am a nurse, a clinical coordinator with the Every Woman Counts program, which is California's breast and cervical cancer screening program that provides free breast and cervical cancer screening services to the uninsured and low-income population in the state of California. and we currently service the San Diego and Imperial Counties region. I provide the clinical support to the clinics that provide the direct care to the patients.
Thank you, Shannon. And then we'll have Sharon.
Hello, Sharon Plachey here. Thank you again, Danielle and Mona, for the invitation. Was so grateful to participate last year as well. And I'm a holistic health practitioner, a brain health coach, and a wellness instructor. And I have several family members that are survivors of cancer. My mom, Ruthie Plachey, has a testimonial in the virtual platform, and she was present last year on one of the panels. She's a breast cancer survivor. And my role is in the life of both the individual who might be in recovery from trauma, illness, and looking for stress management techniques. Particularly, I do a lot of psychosensory work. And also the caregivers. I've been on that side of the caregiver for the beloveds that are in recovery. So I feel like I have a heart and compassion for both sides of that. And then I also have had a real pleasure these last 10 years of working with veterans and supporting them in their re-entry to the community. So it's an honor to be here with all of these beautiful panelists and experts in their field. So thank you. Welcome.
Thank you, Sharon. And then we have Mona.
Hello, everybody. Thank you so much for allowing me to be here today. I'm grateful to work with all of you again. I am a two-time breast cancer survivor. The first time was in '94 and then recently in 2018. And over the 25 years between, I spent that time learning about different ways to take care of that. And I have my own private practice called Motivations Enterprises, where I do cancer coaching. I tailor programs to the individual. I take them from diagnosis through recovery. And I do many different types of complementary and alternative medicine. I teach different aspects of like mindfulness, Mantram repetition, cognitive behavioral therapy, 12-step programs, breathing, talk about chemicals that they can avoid in our hair care products and our cleaning products, all that kind of stuff. Talk about grounding and also electromagnetic fields and protecting ourselves from radiation. I go with a good, better, best approach for working this stuff into your life so that it's not so overwhelming. Thank you again, and I hope you all get a lot out of tonight.
Thank you, Mona. And then Joanne.
Hi everyone, my name is Joanne. I'm the health educator for the Every Woman Counts here in San Diego and Imperial counties. Part of my job is providing tailored health education to different communities around San Diego and answering their questions about just breast cancer. A lot of times women get told to be getting these screenings, but they usually don't have the opportunity to talk about it and ask the questions. So that's what we do. We have conversations with women about breast cancer, and we're really excited to continue that tonight.
Thank you, Joanne. And I want to do a quick introduction for myself. My name's Danielle. I'm a crime prevention specialist at the San Diego County District Attorney's Office Care Community Resource Center, and I'm one of the coordinators for this event. So next we will have Joanne giving us a presentation.
Can everyone hear me? Okay, awesome. So this is just going to be breast cancer health education 101. So let's start off. What is cancer? Cancer is when cells in the body change and grow out of control. We have trillions of cells throughout our entire body. And usually these cells are able to replicate themselves in a normal and healthy way. But cancer comes from those cells that end up mutating, they change. These changed cells can't fix themselves, and then they continue copying themselves. And that's where cancer comes from. So why is breast cancer one of the most talked about cancers? It's because it is the #1 most common cancer in the US and in California amongst women. And it's #1 for every female ethnic group. Black, Asian, Hispanic, Caucasian. It's just #1 in California and the US. So what are some things that make people more at risk for breast cancer? So there's 2 things. There's risk factors that you can't change, such as your age, getting older, your body, your family history of breast cancer, and personal history of breast cancer. So the older you get, the more difficult it is for your body to replicate those cells in a normal and healthy way. A majority of breast cancer, about 73%, are in women 50 and older. The family history. So when we talk about family history, we're talking about your mom, your sister, your daughter. And then personal history, if you've had breast cancer before, that increase your risk of having it again in the future. There are 2 main risk factors for breast cancer. So having breast and female hormones makes you at higher risk and getting older. And then there are risk factors that we can change. So these are lifestyle choices. So lack of exercise. And when they say exercise, it's something like walking 4 hours a week would be considered exercise. Being overweight increase your risk. Drinking alcohol increase your risk. Smoking tobacco increase your risk of breast cancer as well. So there are ways that we can find breast cancer early on. One of the ways we talk about is being familiar with your body, being aware of changes to your body and what's normal for your own body. Everyone's body is different. So just knowing what looks and feels normal for your breasts, and then having a provider that you trust talking to about these changes and getting regular screenings, which brings us into screening recommendations. So current screening recommendations, women with no personal or family history and women who are not symptomatic go and get screened starting at the age of 40. So what are some signs and symptoms that someone may have breast cancer? The most common sign of breast cancer is a lump in the breast or in the armpit. So the breast tissue does extend to the armpit. And there are other signs of breast cancer as well, such as swelling of the breast, nipple turning in or becoming inverted, flakiness or discoloration of the skin, sudden nipple discharge, marks or dimpling, pain in the breast. And pain is subjective for people, but if it's pain that you're not accustomed to, that's something to be concerned about and potentially talk to a doctor about. And then any change in size for the breast too. If one breast suddenly becomes a lot larger than the other one, that might be something to talk to a provider about. So one of the exams that we promote, and we go by the federal guidelines based on what the Center for Disease Control recommends, are clinical breast exams. So we recommend these for women 40 and older. And this is if you don't have a history, personal or family, and if you are not symptomatic. And so the clinical breast exam is usually involves a woman undressing from the waist up, laying down, and then they'll feel around, usually in a circular or up and down motion, for any lumps. But the best way to detect cancer early on is through a mammogram. And a mammogram is an X-ray of the breast tissue. And the amount of exposure to radiation during a mammogram is similar to when you get your dental screening every 6 months and they do the X-ray. So with the mammogram, we also encourage women to go every 1 to 2 years, starting at the age of 40. Again, if there's no family or personal history. And as I mentioned earlier, everyone's body is different. So these are just general guidelines. They may have different screening recommendations for women. And that's something that we'll discuss with the panel. So there are a couple of myths that I want to talk about when it comes to breast cancer. So men can also have breast cancer. It's not as common, but about 1 out of 100 of the people that get breast cancer are men. And young women can also get breast cancer. And a majority of the people who get breast cancer do not have a family history. About 8 to 10% of the people who get breast cancer and are diagnosed have that family history. So it's important for everyone to go and get screened as recommended. So I'll also like to share our provider locator. So through this website is our provider locator, and this will help you find an Every Woman Counts provider in any part of the state of California, and it's as easy as just putting in your zip code. Are there any questions before we continue with the panels?
I do not see any questions right now, and I just want to invite everyone throughout this event, if any questions come up for you, please put them in the Q&A chat box. Okay, well, thank you so much, Joanne, and then I will put it over to you again to begin the moderated panel discussion.
Okay, sounds great. So I wanted to start off with talking about prevention, since that's what the presentation was just about. You know, the key component is really prevention and knowing what the current recommendations are, knowing what resources are available. So I wanted to talk about whole health, and that's a really important component. It's not just screening, but we want to talk about our mental and emotional health when it comes to breast cancer and breast cancer prevention. So, Mona, what are some other preventative measures that we can take to maintain our health?
There are many different things. I've learned so much over the past 25 years of ways to protect myself. You can start by whatever it is you're putting on your skin, you know, lotions and body wash, shampoo, those. You want to look at those and make sure you're not getting a lot of chemicals in there. There are many different products that you can use that don't have, like with a deodorant, they don't have aluminum in. You want to look for that kind of stuff. And like when you're brushing your teeth, you want to have toothpaste that doesn't have fluoride in it. And painting your fingernails. There are a lot of chemicals like formaldehyde and that in fingernail polish. You can get different products like at health food stores that have a lot fewer chemicals in them. And this is where I go to the Good, Better, Best program, that it's hard to just quit altogether. So you could use it for a little while. You could, you know, occasionally use things like if you want to use a whitening toothpaste, you know, maybe use it once a day or once a week. The cleaning products that we use, they're great new products out there. We have so many more opportunities now for us, like washing your laundry detergent. They have dryer balls now instead of using, what do you call it, dryer sheets. Those have a lot of chemicals as well. And going over to like computers and stuff, your computer screens, all of that stuff is giving off radiation. So there's the Emf Protectors. Like for my phone, I have this little disc on here. I also have one for my computer. I wear things such as this necklace that helps to absorb radiation, and also a bracelet. You can do things like grounding yourself, going outside, walking, and walking in the grass, walking on the beach. Being in the salt water is very conductive. And I have a sheet, a grounding sheet that I actually plug into my outlet that helps ground me. And they've done tests on this where they'll draw blood from people, and then prior to them walking in the grass, and then they'll go walk out there for 40 minutes, and then they'll draw the blood again, and then you can see the blood cells they've separated, and they're not all clumped together. There's a lot of great research behind this. So there are multiple ways of protecting yourself, along with you know, exercise, of course, and foods, you know, eating the good healthy foods, leafy greens, citrus, all of that kind of stuff, and getting good healthy water as well. You want to make sure that you're checking your water out as well. So I could go on forever. There are just so many different opportunities. Also stress, your stress management. And I know that Jill and Sharon, they have great information for stress, because when I went through my second bout of breast cancer, I met Jill through the Mantram repetition, and that helped me to alleviate great amount of stress. And I did work with Sharon and with Christina as well. So reaching out to different people rather than keeping it to yourself is very important, and creating a team to help you through it.
Thank you, Mona. Can you talk more about creating that team and, you know, the importance of having a support network?
Yes, creating a team is very important. You know, the first time that I went through it, I was a soldier in the Army, and I just basically did what I was told, and everybody knew about it. The second time, I didn't tell people, because this time I had children and I wanted them to do their own thing and not make decisions based upon my life situation. So I reached out to my surgeon, a therapist, and like I said, I got help through the Mantram and Sharon with water therapy. I reached out to Christina for alternative medicine, and you can have different teams. You know, they were my professional team because they were not emotionally involved with me, and I didn't feel responsible for them. So when you're sharing it with your family, it's very difficult sometimes, because we as women often try to take care of our children, and those were nurturers. So whoever we tell, then we're mothering them and trying to help them through it rather than helping ourselves. So be very selective, and you don't have to tell everybody. You know, I didn't tell everybody this time because I didn't want to, because it becomes, you become cancer. You're not who you are. You know, people don't see you for who you are anymore, and it can change your identity. So, and you can build a team with through the internet as well, through books and videos.
Thank you for sharing, Mona. So I would like to continue on now to screening. So talking about the different types of screenings. So Shannon, you mentioned when in doubt, check it out. So can you tell us what a mammogram is, a screening mammogram, a diagnostic mammogram?
Well, as you mentioned earlier, a mammogram is an X-ray of the breast, and there are two different types. There is what's called a screening mammogram, where they take two pictures, horizontally and vertical images of breast tissue. And then if there's an area of concern, then you might also have them do additional views, sometimes called a magnification view or a spot compression. So those are some terms if the radiologist wants to take a closer look at an area of your breast. Some people say, well, I don't want to get a mammogram. I don't want my breast tissue pressed between two plexiglass plates. And I understand that. But the advantage of mammograms is that they can see breast tissue in a different way, and they can catch cancers very, very early before you can feel anything. But there are other ways that you can look at breast tissue. One is through an ultrasound. And an ultrasound is going to just look at breast tissue in a different way. Might be able to tell you if a lump that you're feeling is, you know, they use sound waves to determine if it's liquid or if it's solid filled. And then there's also MRIs. MRIs are a good tool as well. They use magnets and to help look at the breast tissue in another way. All the imaging are different. None is better than the other. So each is just looking at your breast tissue in a different way to help see things, especially if women have dense breasts. So sometimes what will happen is, because of breast density, they'll need to do additional imaging using the other tests to look for areas of concern of the breast.
And Shannon, can you just briefly explain what it means to have dense breasts and who would have dense breasts?
So many times younger women may have dense breasts. As you get older, there's a lot more fatty tissue in the breast. So when the mammogram is taken with the X-ray, they can see an area of concern very clearly. But if someone has dense breast, which is thicker tissue in the breast, it's hard for a radiologist to see any area of concern. So that's where the other imaging tests can come in handy to see that. So it can, that's what dense breast can mask areas that are not seen on mammogram. So they use other tests. Doesn't mean the mammogram is bad, just means it doesn't see the tissue in the same way.
And what about genetic testing? When would that be recommended?
Once someone is diagnosed with breast cancer, they may be tested for breast cancer, the breast cancer gene, to see if they are a carrier. If they are a carrier, then they can choose to let family members know, and so they can get tested to see if that might make them at high risk. Genetic testing is not always widely available depending on where you're at, but there are resources to get genetic testing covered for free. If you have a direct family member who's been diagnosed with breast cancer, you may or may not have the gene in your family. So there are different ways to get that in through either the company that does the genetic testing, speaking with a genetic counselor at the cancer center that you're being treated at. And there are also studies such as the Wisdom study that help women determine when and how often to get screened for breast cancer, and they also offer genetic testing. But the best thing to do is to talk to your doctor and determine based on your history and your risk to determine if breast cancer genetic testing is for you.
All right. Thank you, Shannon. So now let's continue on to diagnosis. So I would like to direct the question now to Elaine. So Elaine, can you talk to us about the stages of breast cancer? What do they mean?
Yes, so first of all, great talk, Joanne. Very, very informative. So the stages of breast cancer go from 1 to 4. 1 is localized within the breast itself. And I always tell patients that's basically breast cancer that can be cured by surgery alone. And then stage 4, unfortunately, is when the breast cancer has gone to other parts of the body. In between those stage 1 and 4, you have stages 2 and 3. And it's very technical in terms of the number of lymph nodes that are positive and the size of the tumor that makes it stage 2 or 3. But basically, a really sort of easy rule of thumb is sort of the larger the tumor, the more lymph nodes involved, the more likely it is to go toward stage 3. So stages 1 through 4 are really just sort of a measure that doctors use in order to gauge whether or not a patient should get treatment for their entire body because we're worried that cancer spread beyond the breast, or if we should just start with maybe more localized treatment, like a localized surgery. So, so those are the 4 stages. They also, not only does it help doctors in terms of deciding the best treatment options for patients, but it also gives us an idea of prognosis or cure rate. So technically speaking, if a patient has stage 4 breast cancer, because it's spread through the body, or also known as metastatic, it can't technically really be cured. Although I have to say, I've had patients who've had stage 4 metastatic breast cancer who've been alive for 20 odd years and thriving and doing fine. So it's a guideline, the stages for breast cancer, but they're not absolute rules. And there's different percentages given for different stages. And believe it or not, stages are even divided into stage, A and B, like 2A, 2B. So it gets very complex. And every so often, the experts decide to change the staging too and what qualifies as certain stages. So I always try to just tell patients you want to be as low a stage as possible. And that's why, when Shannon talks about, the different ways of screening, like mammograms, it's really important because we want to find cancer in the early stages so we have the best chance for cure and the best survival.
Thank you for sharing that. And I do want to, reiterate what you said about encouraging women and, reminding them that we want to find cancer in the early stages if there is cancer to be found. Some people ask what cancer feels like, and we tell them a lot of times in the early stages, it doesn't feel like anything. It's not like the flu where you have aches throughout your body or anything like that. So that's why, breast cancer is one of the few cancers that you can do preventative treatments for. So, we really encourage the preventative screenings. So I want to continue on, Elaine, and just Could you briefly mention what the types of breast cancer are? I think probably the most well-known one may be triple negative breast cancer, but what are the differences between the types of breast cancer?
Yeah, there's a whole bunch of different technical terms. If you talk to some basic scientists who are doing research on breast cancer, they'll talk about basaloid, luminal, different types of, they look at breast cancers kind of from a very basic molecular standpoint. But in terms of clinically, what we really talk about with patients is we look at hormone receptors. So we look if they're estrogen or progesterone positive or negative. So if a patient has an estrogen and progesterone positive breast cancer, that's actually usually a good sign. And that helps us as doctors because, again, it helps with prognosis. And also, if a patient has a estrogen or progesterone or a hormone receptor positive tumor, then we have a weapon, so to speak, to use against it. So we can give anti-hormonal therapy to help treat that. And there's a lot of studies out there really looking at, should we give hormonal, anti-estrogen treatments to women before surgery or after surgery? So stay tuned. But medications like tamoxifen are the medications that we use to treat patients who have estrogen or progesterone positive tumors. So that's one receptor we talk about. The other receptor we talk about is something called the HER2/neu receptor. So we often say HER2 positive. In the past, HER2 positive used to be something very bad because it tended to be more aggressive. But chemotherapy and other treatments were developed, and you may have heard of them like Herceptin, which treat that type of breast cancer with that receptor. And now it's become actually a very good thing in a sense, because it means if a patient has a HER2 positive tumor, we have something to treat them with. And those patients are really doing a lot better than they had in the past before we developed these treatments. So we have hormones, hormone receptor, estrogen, progesterone, and then we have the HER2 receptor. And so the triple negative refers to being negative for both estrogen, progesterone, and HER2. And unfortunately, if a patient has cancer like that, then we don't really have anything to use against it. And so those triple negative breast cancers tend to be more aggressive and tend to have a poor prognosis, a lower cure rate, a poor, what we call a 5-year survival, because we look at 5 years sort of as the sort of cure mark that we want to, that we sort of gauge effective treatment against. So, so a lot of research right now is really geared toward looking at triple negative breast cancers. And unfortunately, there are some communities that and certain patients that do have higher risks of having triple negative breast cancers. Like the Black African American community tends to have higher rates, higher incidences of triple negative breast cancer. So, so those are kind of just in a sort of a brief overview of the types of breast cancer. The other way to look at breast cancers too, patients may have heard, if you look at your pathology report, it'll talk about, sort of invasive ductal adenocarcinoma or invasive lobular carcinoma. And so those are also another way to sort of describe breast cancers, kind of out of the scope, I think, of this panel, but those are other things that we look at to try to tailor treatments for breast cancer.
Awesome. Thank you so much, Elaine. And just quickly, terminology. So what is benign? What is malignant? What is a lumpectomy versus a mastectomy? Could you just quickly go over those?
Yes, definitely. So a lumpectomy is also known as breast conservation treatment or therapy, meaning we just remove a portion of the breast. A mastectomy is also known as a total mastectomy, meaning we remove the entire breast. In the past, we used to always routinely remove the nipple and areola, but now that's changed. You can have nipple-sparing mastectomies. In terms of the other terminology, you were asking about the, other than the lumpectomy and mastectomy, can you remind me? Benign and malignant. So benign is it can be called a tumor. I try not to call it a tumor because a lot of patients associate tumor with cancer. So I often say it's a mass, that, or a lump that can't spread outside the breast, and that it does grow. So benign things like fibroadenomas do grow, but they grow slowly, and they don't have that capacity to leave the breast, and so they can't hurt you or kill a patient. And so that's what benign is. And then malignant is pretty much synonymous with cancer, and that's a type of tumor, a type of growth, a type of lump that can, grow and then unfortunately spread beyond the breast and becomes something I mentioned earlier, like a stage 4 breast cancer that has metastasized. Sometimes we do lumpectomies or, breast conservation treatment or remove lumps that are benign. There's a lot of shades of gray where some masses are, benign, but yet kind of going toward that fast growing. So there's a lot of shades in between, but to sort of make it I hate to say simplify, but to kind of group those two categories, I would say best to think of as benign as being a mass that won't hurt you, and then malignant, same as cancer or something that can spread.
Thank you, Elaine. So Christina, the next question's for you. So how do you talk to your doctor when you're diagnosed? What do you say? What are your recommendations for women and the men who may be diagnosed as well?
Well, when I'm counseling with men and women, they are working closely with several doctors sometimes, and they have many, many stories, and none of which are ever the same. For example, somebody might have discovered they just got, stage 4 cancer, or someone just is in stage 1, and or multitudes of stories, or they're in the phase where they're doing the reconstructive surgery or making decisions. So often they describe it as just walking into a whole new universe of language they don't know, an environment that is very intimidating, people that they have to trust, that they've just met, and make quick decisions sometimes. So what I always like to suggest is that it's important to have a support system, and Mona talked about this earlier, where you have, some advocates with you, people that can critical think or that offer emotional support. And it doesn't necessarily have to be a family member. It can be somebody you seek out that can help just kind of hold the space for you and counsel and help you walk through the decisions that you want to make in your life without influencing. I'm a big proponent on not influencing. I think people need to make their own decisions, whatever it is, but often they really need somebody that is there just to hold the space and ask those open-ended questions and encourage them basically to talk to their doctor. So a lot of times I come across this kind of language, and simple suggestions are always have a notepad. If you don't understand something, you can write that down and circle it so that at the end, if your doctor has time, you can say I have a few questions and go back and try and understand it, or schedule a time, or talk to, just make sure you make the time for you, and do it in a way where it's your own self-reliant empowerment to ask those questions and make those decisions. And often, like I said, it's just people are very much in limbo on what to do or what not to do, and what their family wants them to do or what their friends said, and it is mass confusion. And then of course what their doctor says, because they're familiar, they know the language, and they have a lot of experience. So again, it's not telling anybody what to do, it's being able to have a support system, however you arrange that, and then being able to, if you don't understand something, don't feel intimidated, ask the questions that you need, or if you're not sure, you can say, let me think about it, for example, and either give an answer the same day or call back or say my follow-up's in another day or two and I'll have that decision, whatever it is. But just in a way, construct your experience with your doctors so you can feel comfortable and settled in your own decision making and start to kind of pull out some of that confusion. I'm sure Elaine deals with this constantly with, you know, talking to your patients.
Thank you. And I want to ask, you know, we encourage women who are diagnosed to go to support groups, seek out support groups, or, you know, having the family support system, whatever works for them. But what about the people who are supporting? What do you recommend for them?
Recommend for the people that are supporting?
Yeah.
What do you mean? What's your question?
People that are diagnosed. So what are some tips for them? Because that's, you know, it's really difficult to be there for other people sometimes when you're...
Oh, you mean the people that are supporting? Okay, I get it. So, well, it should be people that are obviously equipped to help support in a way where it is in a balanced state of mind. And then, like I said, hold that energy. Often people turn to their family members and friends, and there's an extra level of emotional stress. For example, I mean, hundreds and hundreds of stories, but one on one stream would be if there was somebody that wanted to do a certain treatment and they made a decision and everyone's telling them no, that is a lot of stress, or vice versa. I've seen both sides. And all those other personalities are coming from their own reality of what they think's based on their own decision making. So it's just really important to seek out a neutral, supportive, balanced support system. And if you're a caretaker, now that's a little different. If you're a caretaker, you have a family member that is dealing with cancer or different stages or the reconstructive surgery, it goes on. It's not just, you know, one aspect. It's important that even you seek out to have a support if you need to talk to somebody or counsel or you know, do your exercise or whatever it is. But the most important thing is that make sure that your support system, and if you are the supporter, that you're supported. It just goes down the line because, you know, it's all self-reflective in the way that the situation's handled per individual.
All right. Thank you, Christina. So I would like to continue on to treatment and resources. So I would like to direct this at Shannon, since you are familiar with the community clinics. So what resources are available? Medi-Cal, Every Woman Counts, the Breast and Cervical Cancer Treatment Program, private insurance. Can you talk about that?
Yes, so, you know, right now it's Breast Cancer Awareness Month. Everybody's saying get screened, get screened, get screened. And then for people who don't have insurance or may have lost their jobs this year or lost their insurance and they feel like they have nowhere to go, or they might be scared. I don't want to go and get screened because of, you know, of COVID and restrictions from the pandemic. So what we want to encourage people is to get screened. Imaging providers are providing routine screening mammograms. Clinics are seeing patients and they can see people remotely. Most insurances now, including Every Woman Counts, can see patients via telemedicine and refer for imaging based on that. We do encourage a clinical breast exam, but if that's not possible, the clinicians for routine screening can order a mammogram without doing a physical breast exam. So that's always an option for patients. So whether it be through Every Woman Counts for people who have little or no insurance and are lower income, or people who have insurance, they can get screened. Many women are afraid to get screened because what if it is cancer? I don't want to know if it's cancer. I can't afford to pay for treatment. The state of California does have free treatment available for people who are diagnosed through Every Woman Counts, and also for people who have individual insurance and can't afford their out-of-pocket copays and expenses and deductibles. If they meet a certain income threshold, they can also get financial assistance from the state of California. And you do not have to be a documented resident in order to receive these services. You must just live in the state of California and meet the other criteria. So we don't want that to be a barrier as well. So there are lots of resources for screening, diagnosis, and for treatment.
All right, thank you, Shannon. So I would like to direct this at Christina and Elaine. Should women who are diagnosed get a second opinion or a third opinion?
Go ahead.
Oh, yeah, I think so. I really do. And I think the more complex a breast cancer, probably the more important, you know. Now it's up to every person. If you feel comfortable with your, you know, the surgeon that you see in consultation or the oncologist you see, then you don't have to. But I think breast cancer changes so much every day. You know, we have this huge national conference that happens once a year. And I will tell you, the amount of new information coming out is just incredible. So I think it definitely doesn't hurt. And I tell patients this for, you know, not just breast cancer, but other types of cancer too. You know, if it's a complex where you have a lot of treatment options, then it is important, I think, to get a second opinion. And breast cancer is complex. As as I alluded to, there's multiple different ways we have of treating it. We have hormonal treatments like tamoxifen. We have chemotherapeutic agents like Herceptin and other chemotherapeutic agents. So there's a lot of things. And then you have to think about the timing of, say, surgical treatment. So there's a lot of choices that have to be made. And I think it's a good idea to get a second opinion. So, and I always tell patients, go with your gut too. If you feel like there's something that's not quite right, trust yourself.
Mm-hmm. Yeah, I would agree. I would suggest when it's something that's the diagnosis that's serious and you're establishing protocols and treatments and all this, that it's definitely suggested to get a second or a third opinion. And it's nice because each doctor has their own language and their way to go over the different diagnostics and communicate with you. So sometimes you just collect a well-rounded viewpoint that each doctor will offer. And it also sometimes offers a peace of mind that maybe if you were thinking, what if I didn't go and talk to somebody else too and confirm, or what if? So it helps with the what ifs too.
Okay, thank you so much for that. So I want to talk about potential alternatives and complementary services as well. So I'll just open that up to everyone.
Well, I'm happy to jump in, Joanne.
Okay.
I love everything that has been shared, and that whole concept of new language, information overload, and my understanding of our brains and how we process information, that when anyone gets shocking news, right, something unexpected happens, what happens in our brain, we kind of, we want to run away, or we get defensive and we want to kind of put up a fight, and we can get into it with our family members, or sometimes we just freeze. And I'm so appreciative of the technology that exists in medicine today. Like, we can scan the brain and see what happens when a brain goes into shock, right, and trauma. And sometimes getting a diagnosis or all the language is a very shocking, traumatic experience. And so when we're talking about alternative therapies, there's the intervention specifically for the cancer itself. But then there's our experience and who we are. And what we know is the amygdala, which is the part of the brain, the limbic system, that has fear and registers the trauma, needs support, because when that gets activated, our prefrontal cortex, which is the part of us that can process the information, that can have intelligent conversations with the doctors and family members, really goes out the door. So one thing that I really like to offer both the patient, family members, is in the moment techniques that they can self-regulate. And instead of running away with the fear or the panic or the overwhelm, or just everything is a blur, to be able to bring ourselves into a grounded, self-regulated space. So I did give Danielle 3 videos that I think are on the platform, and I really demonstrate some of those techniques. and I know many of us know them, but I'd love to share an in the moment, because even someone listening to this, it might be a lot of information. Oh my gosh, all the different kinds of cancer. And I remember when my mom was diagnosed, she was in shock. I was in shock. My family's in shock. And going through the language and the technology, and then her making decisions for herself and holding her own truth and having her own preference, she was really kind of got into it with some of her doctors. And so I got to experience a lot of these things in the moment of how to calm down that part of the brain. So when it's a lot of information, our brains race, right? We get that busy beta brainwave, and we get these high spikes of gamma, and everything is kind of like red alert, red alert. And there's so many wonderful techniques now, whether it's breathing, mantra, all these different aspects that can calm down the brain. But what happens if you're sitting in the doctor's office and you need to just self-regulate for a minute? There's a wonderful psychosensory technique that immediately starts activating more delta waves. And that's the wave we have when we go into deep sleep. And our brain and our limbic system registers that we're safe. It's going to be okay if we can activate more delta waves. And so I also do neurobiofeedback, and this very simple exercise of your palms together, they've proven starts to activate more delta waves. It actually will slow our breath down, so that like red alert anxiety moment starts to regulate, so we can feel our body, we can be present, we can listen more effectively. And we could do this sitting in the doctor's office, right? Or with our family member, or in the waiting room. So there's 3 places on the body. So when you're saying alternative techniques, I love stuff that works in the moment, right? So this kind of technique, in the video, I demonstrated going from the shoulders to the elbow. So this at a pace of about 1/100,000. So if you're in the doctor's office, you could just do one side. It's like you're smoothing your ruffled feathers. And it actually is biochemically changing your brain, right? And everyone's gone off the rails a little bit right now, right, with the pandemic. Then you add in like illness or medical terminology. And so this kind of thing is so crazy simple, and the neuroscience behind it is amazing. So you can rub your hands together like this. And we actually do this already. You know, someone goes, hang on, let me think about that. They don't even know what they're doing intellectually, but sensory somatically, we know it works. And the third one is rubbing across your forehead or across your cheeks. So, you know, when someone gets overwhelmed, they're just like, okay, hang on, okay, what was that? You know, this kind of thing. And so we have nature, right, gave us these really cool, simple techniques that lower that cortisol level. You know, when we think about cellular repair and calibrating the body-mind, it's biochemical, right? It's electrical. So anything that can downregulate the stress. And, you know, support groups, oxytocin, right? Women get together, we feel better, right? The happy biochemistry of serotonin. This actually upregulates serotonin in the brain, right? It creates more oxytocin. So these practical things, regardless of what the next step is going to be, can be so supportive in the moment. And I'm right there with the anxiety of like going and getting a mammogram. Since I have family history, there's always that little like, oh, you know, when I go in, are they going to find something with me? But I can use this in the waiting room, right? I can even just down-regulate the stress. And I know biochemically and cellular repair and everything it needs, my body and mind needs to be healthy, can be available for me. So that's one like on-the-go technique that I want to offer everyone, that the power is in your hands, right? As well as in your breath and your intention and focus. So.
That's amazing. Thank you. I'm just over here doing the same thing.
I just want to segue on that. I love those techniques because you're right. Our bodies, oftentimes we automatically, you know, will calm ourselves. And I too, I had a mother that has had breast cancer way long time ago. They did a radical mastectomy back then. They didn't know, you know, things have advanced so much more. And I've had a couple of, you know, checks and had ultrasound and MRIs, and I've had all the whole kinds of treatments. So I know what it's like to be in the waiting room. I've been fortunate that I have not been diagnosed. But along with these techniques that are portable, invisible, readily available, and that's what I've spent most of my last 20 years is teaching people a similar kind of thing, Sharon, but it's more of a mental strategy. And we often relate it to quieting. How do you quiet your mind to tap into the inner calm? And so the program we teach is Mantram repetition. And the philosophy is that we as human beings, we have a mind, we have a body, and we have a spirit. And in that spirit is where we have all of our, resources, our wellness, wholeness, kindness, calmness, health, and well-being. I mean, I think that most of us would agree that we have that capacity, but what happens is life gets in the way and our minds get so speeded up that we cannot calm down enough to tap into those inner resources. And so one method, and there are many methods, but one method that we teach is Mantram. It's like mantra, but we call it Mantram because it represents the teacher and the guidelines, Eknath Easwaran. And it's a word of phrase. He calls it a spiritual formula for transformation. It sounds kind of, the words are different spiritual traditions, and the idea is that you begin to repeat those words and phrases and repeat them not only when you need them, like, oh, I'm going to go see the doctor and I really need this, but to repeat them when you don't need them. So in other words, you're preparing yourself for these potentially disturbing, upsetting, anxiety-producing events by practicing all the time. So I'll just give you one example. Mahatma Gandhi, probably heard of him. He had a mantra that was Rama, Rama, Rama. That's just a simple syllable, Rama, Rama, Rama. And it means joy within. And so if you can wrap your mind around a word or phrase and repeat it over and over again, that can also be a way of calming yourself. And that's what we found. You mentioned, Sharon, like in the waiting room and so forth. We had veterans with PTSD, and they would be in a situation that got triggered where, they might hear a helicopter or something and they get their PTSD triggered, and they had their mantra because they'd been practicing when they didn't need it. They were able to call upon it. They were able to remember it when they did need it. So it's just another one of those great strategies and things that, I just wish everybody knew about. You just wish we all can use these kinds of techniques because we all experience stress in life. So I can put some information in the box, some for resources and things. I'll type something in there about mantra repetition and share it that way.
Thank you, Sharon and Jill.
I do want to say that we will be sharing Sharon's videos and Jill's resources on our Instagram and Facebook pages throughout this month. So, and I'll put our Instagram and Facebook names and handles in the chat too, if you want to check those out.
I want to continue the conversation about brain and breast cancer. One of the big things that women were asking about last year when we had started this was about mindfulness. So can you ladies talk about where mindfulness fits in, how it can be a benefit, how women can apply it?
Well, I love it. Like our minds are full of stuff, right? Like what are they full of? Like often we can be full of cyclical patterns of fear, right? Negativity, anxiety. And I think a lot of us will agree there's sort of this like the big C, right? Cancer, where our heads fill up, right? We get full of all kinds of stories of people we've heard or worst case scenarios. And I love that in our Western culture, mindfulness has really found its legs and, brought up to speed and fills our lives, because we know every thought and every emotion creates a biochemical cascade, right? So everything we're thinking and everything we're feeling is impacting our cellular repair. And so I really believe we're at such a pivotal point in our personal and collective lives to take a step back in awareness and start to be mindful of what's filling our minds, right? We've heard that we are what we eat, right? We are the company we keep, right? We are our thoughts, right? We are all the emotions that we're running. So mindfulness is the invitation. It's sort of that pause to step back and create personal awareness of what is my diet? What am I feeding myself? And then there's so many amazing paths and opportunities to really rewrite those scripts. And I remember when I first started looking at what was part of the unconscious mind, what am I telling myself? Things that I would never say to my friends, I'm saying to myself, right? I'm feeding myself a negative diet. And we think about health and healing and wellness. Yes, it's what we're eating and our exercise, but it's also what we're feeding ourselves in our belief systems. And mindfulness to me and the sleep cycle really are critical, because one of the biggest issues we have in modern day society is we're not sleeping well. And to have good cellular repair and regeneration, we have to sleep well. So mindfulness to me happens during the day, but it's also this wonderful invitation, right? To have, what are we mindful of as we go into sleep? What's our intention with our sleep? What are we mindful as we emerge out of sleep through these impressionable theta and alpha waves and carry into our day? You know, we've heard the power of the gratitude journal, focusing on 3 things at the beginning of the day. That's a mindfulness practice. That really, it's like looking at life through rose-colored glasses, or I'm choosing to love my life. I mean, there's always going to be things that we didn't expect or we would prefer are different. And then how can we spin that around? So like mindfulness for me, with this sheltering in place, all of my neighbors went a little crazy. One was playing heavy metal subwoofer, somebody else got a rooster, you know, somebody else was doing construction, and there was so much chaos around my house. And without mindfulness practices, I think I probably would have just gone off the edge, right? But my mindfulness practice allowed me to step back, say, okay, here we are. What's the best that I can create in this moment, right? So doing my breathing techniques, down regulating the stress, focusing on what I loved and appreciated, and being proactive. So, you know, mindfulness, I really feel, is our Garden of Eden. It's the place we can create our own experience and our own wellness. And then that flows out right into the lives of others. So, and all the paths of mindfulness right now are just rich and ripe and juicy. And, you know, with our electronic platforms, anyone who has a desire to learn any mindfulness practice, it is so available. And I can honestly say, you know, Dr. Amen, one of my mentors with his clinic, was really saying, you know, depression and anxiety has been going off the Richter scale with our current situation. And then you add the whole focus we have with breast cancer, you look at the increase in domestic violence. The invitation, I think, for each one of us as our individual and an advocate in our world is our mindfulness, right? What are we thinking? Bringing our hearts into the conversation and really speaking from a place of loving kindness and progressive problem solving. I feel like the time is now. So I'm so grateful that we're speaking to the choir here, because I know everyone that's listening, they're already here. And thanks for sharing the journey, right? The power of mindfulness.
Thank you, Sharon. So I want to ask Jill this. You know, it was mentioned that a lot of times people may be scared off by other people's stories of their experiences with breast cancers, or the stories that people are sharing about it. So what are ways for people to kind of not get scared of those anecdotes, and how do we avoid that and the whole worry around breast cancer?
Mm-hmm. I don't know that we can avoid feeling the anxiety, but there's things we can do to manage that anxiety. And as I said, what we teach with the Mantram program is practicing repetition of the mind, and it's training attention. It's like lifting weights. So it takes some practice. But the idea is that if you've been practicing, repeating your word, your phrase mentally in your mind during all the times that sort of downtime, I call it, Mantram can be a screensaver for the mind. So when you are not already focused and engaged in something, but you're just walking down the street, or you're just on your way to your car, or like when you're waiting in line at the grocery store, and you practice that repetition, then when the anxiety does hit, when you do get news, you've had the practice already. So I think there's a lot to be said about practicing these different types of techniques so that you're prepared to manage that anxiety. And I think that that's where we need to find, like Sharon was saying, you can go online and you can type in mindfulness, and there's like multiple different strategies and ways. And so the key is to find something that fits for you. I was always drawn to Mantram repetition because of the spiritual component. I was interested in that idea of spirituality. There's a lot of other things that are more body related, like Sharon was talking about, but I think that you've got to practice it, because you forget. And in that moment of anxiety, or that moment of, if you get bad news, your amygdala will be hijacked and you will fight or flight or freeze. And so it's the practicing and making something a part of your day. We always talk about make Mantram a part of your life. Make it something that is so natural that it just comes to your mind automatically. As you go to sleep is a great time to repeat Mantram. When you go for a walk, you can do it all the time. So that's just, again, one strategy. But I know that we will have anxiety, and I can't think we can make it disappear, but we can manage it. We can, hang on. Like Gandhi said that his Mantram was his staff of life that kept him through every ordeal. So it was something to hang on to.
Thank you, Jill. So I want to bring it to Mona. So Mona, I just want to get your perspective on this. So what are some other tips that you have for people who may feel overwhelmed or depressed or having anxiety while dealing with cancer?
It's important that you try to stay as normal as possible. If you can continue working, that's important. You want to be able to lessen your workload, and feel free to talk to people about it. You talk to your boss, talk to your coworkers, let them know that you are going through treatment, and protect yourself also to make sure that you're not going to get sick, because your immune system is compromised during this time. And support groups aren't for everybody. When I first went through it, I ended up with a support group of a bunch of old ladies, and I was 30. I was 26 when I first had breast cancer, but then I got married and had a baby, and then I was pregnant with my second baby, and here I'm in this support group, and they're all talking about dying, and I'm just starting to live again. And make plans, do things, have fun. Remember, you can laugh through this. And the second time I went through it, to me, I called it my cancer experiment, because I was practicing all these different modalities. I was practicing Mantram, I was practicing mindfulness, and like when I would go in for chemo, the mindfulness, that there 9 attitudes of mindfulness from John Kabat-Zinn, the founder of mindfulness. Beginner's mind, non-judging, acceptance, letting go, trust, patience, non-striving, gratitude, and generosity. And I would go in with that beginner's mind, where I learned to relax my body. And when they were doing the IV, I got to the point where I didn't even feel it going in. Prior to that, I would be tensed. I was tense, and I was going off of the memory of what it had felt like before. So relax your body. And Dr. Amen, the one that Sharon brings up, he had a great meditation in his book that where you could heat up your hands. And when you do that, when you're breathing and you're imagining maybe holding a cup of hot tea or your hands in front of a fire and bringing that warmth in there, that helps the blood flow. And so that makes it so much easier to get an IV. And think about how it's medicine. It's medicine to help your body. Any treatment that you're going to take, you have to be in agreement with that treatment, that it's going to help you, because if you're not in agreement, it's not going to help you. So just practicing that breathing, practice boundaries, because you need to give people boundaries. It's like, you know what? I appreciate your input. However, this is how I'm going to do things. This is my choice. This is my body. And you can do this with your doctors as well, because certain medications were presented to me and I said, no, you know, I'm not taking that. I've done my research and I don't agree with that. So being your self-advocate, stand up for yourself, and know that you are worthy. You might have had surgery where you're not feeling like a whole woman again, or a man. I know of men who've had breast cancer. So just go with it. And that's what I love about Mantram, is because you're going into the inner resources within you, what's within you. And that's where you get your answers. So that helps you to bring that peace and strength. I found it joyful to go to like radiation. I met so many great people there. I felt joyful, like I was going there to meet amazing people. And we talked about our families in the waiting room. We talked and we showed pictures and stuff. We didn't talk war stories. So really focus on the words that you're saying, what your focus is. And when you do that, then you can really have a beautiful experience. You can change the way you look at cancer and the experience. You know, that's, for me, it's a paradigm shift. How do you want to experience it?
Okay, thank you so much, Mona. So Shannon has a quick comment that she wants to make.
Mona, you really reinforced how attitude is everything, because as an oncology nurse, as someone who used to take care of cancer patients, people would always ask me, and still ask me today, what is it like? What should I expect? And I tell them, going through cancer, regardless of what type, breast cancer, any other kind of cancer, is going to be unique to everybody. But what will make all the difference for you is your attitude. You could, if you approach it in a positive way, it's going to be a positive experience. And just as all has been echoed by all the speakers here. And it's so nice that we have so many more tools than we did 20 years ago. You know, when people thought cancer was a death sentence, and now people live and they have thriving lives, and there's so many resources. So it's just nice to hear that in the community, not just in the nursing world, in the direct care world.
Thank you, Shannon. So I would like to change directions and talk about clinical trials and being part of breast studies. So I'm going to direct that over at Elaine.
Yes, so clinical trials are one of those things that it's how we make changes and differences. So in the past, you know, every woman with breast cancer used to have all their lymph nodes taken out, and and because of clinical trials, we found that we don't need to do that. We can do something called a sentinel node biopsy, where we just take out, you know, the key lymph nodes. So clinical trials are really important. My nonprofit really focuses on communities that have been traditionally sort of ignored, under-resourced. And so we really try to work on trying to get more of those communities involved in clinical trials, but it's difficult. I mean, I'll have to give you some background. My dad was in the camps during World War II, and so he has this real deep mistrust of doctors. And so I don't think I could ever get him in a clinical trial. But that being said, I think it's still important to do. A lot of big organizations have clinical trials. We're a small nonprofit, so we're not part of any of those at this point. But I think it also goes toward, you have to feel comfortable joining the clinical trial too. There are a lot of little requirements. Once you're in one arm of the trial, you sort of have to stay there, although you can always, it's important for patients to realize you can always drop out too, though. You don't have to complete the trial. So there's opportunity there for sure. But again, I want to just kind of echo what some of the other panelists have said. It's really important that you take care of yourself, that you feel comfortable. And that same goes true not just for your doctor, how you relate to your doctor, but also how you feel if you take part of a clinical trial.
Right. Thank you, Elaine. So we currently don't have any questions in the Q&A. So we would like to open it up to any final messages or things that you ladies on the panel would like to share. And I'll start with Sharon.
Thank you. Again, my heart is with the individual, right? The patient and their whole support team, right? Their family, their care providers. And I've been both the caretaker of my mother and the support team for many clients over the years. And I love the fact that Mona brought up boundaries. And boundaries to me is, it's the greatest gift we can give ourselves and others. And I remember that I had this realization that my needs, wants, and desires really are divine. They're purposeful. And being able to know what I need and share that with loving kindness is part of having a boundary. And as much as I have a desire for someone to really hear me and acknowledge and honor that, I also want to know what others need and also have the capacity to have the loving kindness and honor what their needs are. And I remember when my mom made a decision to not do chemotherapy and radiation, and she said to me, "How do you feel about that?" My mom's 84, she lives with me now, and she's had a success, and she did a lot of natural approaches for her recovery and healing. But she asked me, how did I feel about that? So she gave me her boundary, and then she asked me what my experience was. And what I shared with her is, I said, every soul has to choose. Everyone has the divine right to choose their choice, their outcome, and have it be as they so choose. And the greatest gift I can give you is my support, and honor that regardless of what the outcome would be. So boundaries to me is that greatest gift to myself and others, and having that be present with deep respect and loving kindness and gratitude that we can choose, and it's all going to be okay. And I love my mom's testimonial because it's so sweet, as an 84-year-old woman, just sharing from her heart that whatever we choose and whatever the outcome, it's going to be okay, because it's always wrapped in the arms of love. And she said love has always pulled her through. So thank you.
Thank you, Sharon. Jill, would you like to share anything with the audience?
Well, I heard you talk about clinical trials, and I think the wisdom study is one that came up, and I think I just recently got an email and I just signed up for it. So I'm a subject in the wisdom study, and I'm looking forward to doing what all I have to do. I just joined just recently, so I don't know all the next steps, but I've just maybe, does someone else on the panel know more about that study that you could just say a few words about?
I do. Actually, I was interested because I do have some cancer in my family, and it's related to breast cancer. It's not breast cancer. And I have wanted to know more about my risk of getting breast cancer and how often to be screened. So that's why I joined the wisdom study. It was free, and the genetic testing is also free. And then depending on your results, you can get a consultation with a genetic counselor and a nurse with the study. So it's very informative.
Great.
Thank you. Shannon, is there any last comments you would like to share?
Please get screened. When we catch cancers early, you have the best chance at treating it early and having the best outcome. You know, and in the unlikely event that it is something, because most masses and breast problems are benign, but in the event that it is something, catch it, you know, take care of it early. If you're afraid, get someone to support you. And then that way we can catch things early, treat things early, and have the best outcome for you.
Thank you, Shannon. Christina?
I wanted to touch upon the mindfulness, and I like practical tips. I think sometimes people are visual and they need to see something so that they can relate to it and remember it. I had the opportunity in the 80s and 90s to work with Dr. Emoto. Some of you might know, but he was able to say the words and capture in the water crystals when they were frozen. You were ugly, looked deformed and ugly. You are beautiful, or I am love, looked perfectly in a sacred geometry shape. They have something you can probably look up on YouTube about rice and 4 jars of rice and say ugly to one or whatever you say that's positive to another and so on. And one stays more fresh over months, one gets all rotten and so on. So practical tips and suggestions would be, if you're in a situation currently where you are have a family member with cancer, or you do, and you're hearing all this advice, you could find what works for you, that inspires you, that makes you laugh. If you watch funny movies, if you are in a meditation, or you remember something that you love that you never set aside to do. Put little notes on your steering wheel, on your bathroom mirror, on your refrigerator, when you wake up, on the ceiling, whatever it takes to kind of encapsulate yourself in positive vibrations of the thoughts, which are a frequency. They're showing a lot of this now. You can even watch YouTube videos on sounds, and it forms beautiful symmetrical designs. Color, there's even programs that have been installated into hospitals where they have color therapy. So there's lots and lots and lots of different tiny modalities that are practical that you can utilize, that don't need to cost anything. And just highly still recommend to have a support system around you where they're able to hold the space, and don't be afraid to ask or speak up. And not everybody's in a place where they're happy and they're just, okay, I'm going to be loved. A lot of people are angry, or they're hurt, or they're in shock. So these other emotions should be considered in a way where each person literally has a starting point and nobody starts in the same place. So.
Thank you, Christina. Continue on to Mona now.
Great. I'd like to piggyback off what Christina is saying. I really loved how she brought up Dr. Emoto, because he has done some amazing studies. And I have glass water jars, and I like to write those positive words on the water. And he's done those studies. He's done the scientific research where it works. And our bodies are made up of a large percentage of water. So that's very important. And thinking about, you know, for the second time that I had the cancer, there were 2 major things that happened in my life that year prior to diagnosis. And both times, once was personal, once was business, I shut myself down, and I went ahead and supported a person I was involved with and the person I was working with. And, you know, I wanted to leave my relationship, but I stayed. And I wanted to end my business relationship, but I stayed. I went against my gut on both. And so I feel like I betrayed myself. And then after that, I was diagnosed with breast cancer. And so it's so important to take care of yourself first. When you take care of yourself first, you have the energy and the love and the compassion to take care of others. Otherwise, you end up resentful, because I was very angry. I was very resentful, and I ended up paying for it with my health. So when you take care of yourself, you teach others how to treat you. So put yourself first, take care of yourself, and don't wait. You know, I found both of my tumors myself, and I took myself to the doctor, and it was just an intuitive thing that second time. I just kind of felt like I had a whisper, said, check here, because I was guilty. I didn't do the monthly exams, but holy smokes, there it was. And so the sooner you get in there, the better your options are. And the second time I went through it, I did not get sick with the chemo. I did lose my hair again, but I felt strong. I felt happy. I met amazing people. Half of them are on this panel right now. And it can be a really amazing experience. Again, with that mindfulness, you know, with that child mind, you want to go into it with the idea that this could be life-changing in a very positive way. So I encourage you to get yourself screened and take care of it.
Thank you, Mona. And I would like to give the floor to Elaine to make the final comments.
Well, I'm kind of glad I get to go last because I think it's all been said. And I think all the panelists are amazing, very inspirational. And I'd like to, you know, echo what Mona said about trusting yourself. And you know, a lot of women find things themselves. And so, yeah, just trust yourself, be good to yourself. These complementary, you know, things like using Mantram or the rubbing the hands, I think that's great because I think it's important to support ourselves in every way we can. You know, medicine can't do everything, so we've got to make sure we have whatever else we need, whether that be support system or other ways of making it through. So yes, I definitely agree. You guys are amazing.
Thank you to all the panelists. I really appreciate everyone taking the time to participate in the panel, add their perspectives and their expertise, and just increasing awareness by educating women about all the resources out there. You know, we really promote whole health, you know, so diagnosing the cancer is just one component of it, but we also have to educate women. That's why we provide the health education. We have to make the resources available to the women. You know, we talk about lifestyle changes, things that we could add into our daily life before we're diagnosed with cancer, if we ever become diagnosed, and the after and the during. So we really appreciate everyone just sharing, you know, everything available that people may not have thought of was even available or could be helpful. So we really appreciate everyone taking the time again.
Okay, yes, and I'll reiterate that. Thank you again, everyone, for being here tonight. Thank you for the people who attended for taking the time out to be here tonight. The last thing I want to do is the raffle that I have here. So I'm going to choose a name. And the winner is Lori. So Lori, I see that you are here tonight. And you also registered using your email address. So we will be emailing you to ask you where you would like for us to send your $25 gift card. So look out for that. It'll be coming from Care Resource Fair at stcda.org. So with that, I would like to thank everyone again, and I hope that everyone has a wonderful evening.
Thank you. Bye-bye.
Thank you.
Bye-bye.